Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua. Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Hello everyone, how are you today? Let me introduce myself. My name is Muhammad Khadafi Akasyah, and I'm from 15th Vocational High School Bandung. I'm here representing my school as a participant in lomba kompetisi siswa in health and social care. Today, I will present an educational video about cardiovascular diseases, stroke, and hypertension, as well as the rehabilitation process that the patient of the stroke needs.
Cardiovascular diseases, or CVDs, are a group of disorders that affect the heart and blood vessel, including coronary artery diseases, or CAD, congestive heart failure, cardiac arrest, hypertension, and stroke. Now, let's take a closer look at one of the most serious types of cardiovascular diseases, stroke.
Okay, ma'am, so your result is 160 per 90 mm hydragium. So the result is about to high, or we call as hypertension. Stroke is a medical emergency that happens when the blood supply to the brain is interrupted. This can cause by a blockage or ischemic stroke, or ruptured blood vessel, or hemorrhagic stroke. When this happens, the brain doesn't get enough oxygen and nutrition, so they can start to die within a minute. And one of the main causes of the stroke is hypertension, or the blood pressure is about to high. When that happens, blood vessel is about to burst, leading to hemorrhagic stroke.
The effects of stroke can include paralysis or muscle weakness, trouble speaking or understanding speech, memory and thinking problems, and in several cases, even death.
Early detection is very important. You can remember quickly by the acronym B FAST. B, E, F, A, S, and T. B stands for balance, sudden off balance coordination. E stands for eyes, sudden off eye trouble seeing. F stands for face, face dropping or uneven smile. A stands for arms, can't raise arm properly. S stands for speech, slurred or strange speech. T is time, time to call emergency. Dial with 112. And remember, be fast.
After a stroke, a patient may experience hemiparesis, weakness on one side of the body, aphasia, difficulty speaking or understanding language, memory and thinking problems, emotional change like depression, difficulty swallowing or dysphagia, or trouble with bowel and bladder control.
Diet recommendations for stroke patient. Carbohydrate, moderate to high in lean protein, high in healthy fat, rich in antioxidants. Broccoli, avocado, green beans, carrots, spinach, strawberry, olive oil, tempeh, brown rice, papaya, salmon. Patients with stroke, don't forget this: low salt, stay hydrated, low saturated fats and trans fat, avoid fried, salty, and processed food. Adjust food texture, low sugar, instant noodle, canned soup, soy sauce, fried chicken, nuggets, sausage, popcorn. That's why the rehabilitation after stroke is very important. The goal is to keep the patient recovery, their abilities to improve the quality of life. This requires a team approach that focuses on social, mental, and emotional recovery. First, physical therapy. Stroke often causes muscle weakness, paralysis, and limited joint mobility, especially on one side of the body. Physical therapy plays a critical role in recovery, and range of motion or roam exercise are a key part of it. There are two main types: active roam, where the patient moves the joint on their own, and passive roam, where the therapist gently moves the joint for them. This exercise helps maintain joint flexibility, prevent stiffness, improve circulation, and support the recovery of motor function. Second is occupational therapy. This focuses on daily tasks, what we call activities of daily living or ADLs, like buttoning a shirt, combing hair, or folding clothes. These simple routines help stroke supervisor regain independence. They also strengthen coordination and boost confidence in doing things for themselves again. And the last is psychological and psychosocial therapy. Stroke doesn't only affect the body, it affects the mind too. That's why emotional healing is just as important as physical recovery. Group activities like discussion, singing together, or praying as a group help patients feel supported, uplifted, and understood. These small moments of connection reduce anxiety, improve mood, and remind them they are not alone. I hope this video will give you more information and education around stroke. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.